Now we're talking about your health. If you struggle with blurred vision or blind spots, it could lead to a more serious issue. And Dr. Matthew Welch is going to tell us all about that. Thanks so much for coming in today.
Very happy to be here.
Well, let's talk about the condition that you're really worried about.
Macular degeneration.
Okay, I've heard about this before. What exactly is it? What does it do?
So it's a really important topic because upwards of 10 million Americans have this, and it's thought that by 2015 that number is going to double. When you look worldwide, upwards of 200 million people have macular degeneration, and it is the leading cause of blindness in people in this country over the age of 60. It's a disease that affects your central vision, and so you oftentimes lose the ability to read fine print, maybe even see the fine facial features of your friends and family.
Are there different types?
So there are generally two types that we talk about. It's obviously more to it than just that, but we talk about dry disease and wet disease. Dry disease is the more common, with about 80% of people having that, while 20% develop wet disease.
Okay, and why is it important to determine if they have wet macular degeneration?
So really for two reasons. One is because it's treatable. The second is because 90% of blindness associated with macular degeneration comes from the wet form, so it can be very devastating.
I did not know that. How do you treat this?
So the way that we treat it, and I have this conversation with patients every day in the office, doesn't sound pleasant, but is actually very straightforward, and it's with shots of medicine into your eye. That's not anything anyone ever wanted to have done, but hundreds of thousands of people today across the United States are going to have one. And when we talk about doing that, we talk about giving a shot here into the back cavity of the eye. This back cavity here, called the vitreous, is where we deposit medicine.
And you brought the type in today that we think of.
Yeah, so I brought one that's the real and the other that's kind of the example. So
this is what you would normally, this is what you would use?
Yeah, and it's really hard to see, and I would say that's intentionally so. If you actually take it here and squirt it out, you can't even really see it on the camera, the amount of medicine that goes in there.
So just a little bit and it goes right here.
It does.
Okay, now that's how you treat it. What about clinical trials, research? What roles do they play?
Well, so clinical trials are key in this disease because it's still an evolving process and treatment. We've only been treating wet macular degeneration in the form that we do now with what's called intravitreal injections, as we talked about here, since 2005. So a very short period of time. Prior to that, we had some treatments that really weren't very effective and definitely did not have any kind of positive visual results. When we look at treating people today, upwards of a third of people will see their vision improve from where they are at the time of diagnosis, presumably with some degree of vision loss, which is really remarkable, especially when you think about 90% otherwise going to blindness. So the trials are ongoing, and we actually just got our first new medication, so now there are four medications we can use for this condition.
Now, of course, you're with Associated Retina Consultants. Tell us more about that.
So we are an all-retina practice. So so we only take care of diseases of the retina and the vitreous, the back of the eye. We're kind of the buck stops with us. So if you need to be fixed and some other ophthalmologist or eye care professional can't take care of you, we're your source.
Okay, and if you have any information, everyone, you want to know where they're located, set up an appointment or a consultation, just go to AssociatedRetinaConsultants.com or call the number on your screen.